Hello everybody, my name is James Curtis, and in this video I'm going to show you how to take vital capacity. Vital capacity is a measure that you can integrate into your swallowing assessments, cough assessments for people with dysphagia, as well as use it to derive low-tech aerodynamic measures of a voice. So to measure vital capacity, you need some sort of spirometer device. These are typically expensive. However, there are low-cost options out there. The one that I'm going to show you is the baseline windmill type spirometer. You can find this online. It typically runs around $100 US. And with it comes disposable mouthpieces that you can then use to use this between patients. However, I think from an infection control standpoint, it's ideal if you can actually attach a respiratory bacteria filter, get rid of the filter between patients, and then wipe this down between patients. So in order to attach a respiratory bacteria filter like this to the device, you need some sort of adapter. And so the one that I have has around a 6 millimeter outer diameter on one side and a 6 millimeter outer diameter on the other side. And I will supply some purchasing information. I've got no financial conflicts of interest, but something that you can use to try to find similar types of products. So you will attach the adapter to the windmill mouthpiece. You'll then attach the bacteria filter to the adapter. Now for the spirometer, it has a dial and it has a measurement that goes from 0 to 7. This is measuring in liters of air. So for milliliters of air, it would be 0 to 7,000 milliliters of air. As someone blows into the device, the needle will move to show you how many liters of air they've exhaled. So then between each trial, you have to just reset the device back down to 0 or 7. And so when you measure vital capacity, especially if it's not a forced vital capacity, you're going to have to instruct someone to breathe in as much air as they can until they cannot breathe in anymore. The idea is that we want to get them to 100% of their vital capacity range. They then will seal their lips tightly around the respiratory bacteria filter, and they will blow out evenly but forcibly for a good 5 to 10 seconds until they're completely out of air. This should then be repeated 3 times, and then you record the maximum of those 3 times. There is definitely a learning curve, and so people typically have much lower ratings for their first, maybe even their second trial, and by the third trial, they should be relatively accurate. So I'll show you what this looks like. I'm going to take a big breath in, and I'm going to blow until I'm completely out. And so here we can see that my vital capacity is around 44.5. Actually, this is around 4.6, which is around 4,600 milliliters of air. That is actually a pretty accurate representation. I've now done this a couple of times. And so my vital capacity is around 4,600 liters of air. Repeat it 2 more times, record the maximum, and that is the vital capacity.